A growing body of scientific evidence suggests that smokers are less at risk of contracting COVID-19 than non-smokers, and cigarettes may turn out to be some kind of protective measure against the disease. At least 28 studies across a range of countries have found fewer smokers among COVID-19 hospital cases than in the general population. For a South African perspective now on the study, let's speak to Dr. Kgosi Letlape, who's co-founder of the Africa Harm Reduction Alliance. The doc joins us now via Skype. Dr. Letlape, thanks very much for your time. It certainly feels counterintuitive, isn't it? The fact that smoking could in some way shield you against contracting the virus. Let's start by taking a step back and get a sense of, if the data is available, how many of South Africa's COVID-19 hospitalizations are actually smokers.
That analysis has not been made available, or if it is, I have not seen it. And it is critical that that be done, that we know what is the percentage of smokers amongst those that test positive, what is the percentage of smokers amongst the admissions, and more importantly, what is the percentage of smokers that have severe illness and end up in ICU, an analysis of the percentage of smokers amongst those that unfortunately pass away from complications of COVID-19.
Does it strike you as odd, though, these suggestions in these 28 studies that we've quoted? You know, the fact that, in fact, you could be better off as a smoker, at least in your response to COVID-19, considering, of course, also the logic provided by government about why we're banning the substance to begin with?
I think that is why everything has to be evidence-based and not based on our opinions or beliefs. And I think what is being said needs to be verified. We need to have our scientists conduct studies to refute or verify what is being said. But if you look at published numbers of smokers amongst the COVID numbers from other countries, the numbers of smokers are less than the percentage of smokers in the general population.
It does certainly also open up a conversation about nicotine in general. Can you think of a situation where nicotine and its anti-inflammatory properties could in fact stave off a virus, even if it's not COVID-19?
I think we have to see those as suggestions and speculation, and it should be subject to thorough analysis and investigation. And we need proper studies before we jump to conclusions about anti-inflammatory properties. When you're dealing with something that creates as much controversy as tobacco does, it should be based on solid studies and evidence. It's something that needs to be investigated before we jump to conclusions. We need to be cautious about, when we see an observation, jump into conclusions without doing proper studies to verify. And I think people need to understand that the position around smoking should remain the same, where we encourage people to quit, and those that can quit need to look for less harmful ways of getting their nicotine and move away from combusting tobacco.
There's also, of course, been a conversation around the ritual of smoking, if anything else, and that in part contributing to the spread of COVID-19. You mentioned a bit earlier on that, you know, our decisions should largely be based on facts and not necessarily opinion and perception. Do you get the sense that the regulations as they stand are not based enough on fact as perhaps they might be on opinion and perception?
If you listen to the rationale given, you did a clip from the Minister of COGTA, and she spoke about opinions that came in from the public. These were not scientists. They were not providing evidence-based information. So it's based on opinion. It becomes problematic if we begin to base policy on what people say. If you base your policy on how we treat foreigners based on what people say, it would be horrendous policy. We need to base things on ethics principles, and particularly for medical decisions, it should be science-based. So it would be helpful if the government shared with us analysis done by our own scientists in terms of smokers amongst the people affected with COVID. There's also an issue of concern. When we're concerned about people sharing cigarettes, My greatest concern is people not observing physical distancing. So even if you're not sharing that zone, if you're within a meter of a person that is exhaling and inhaling and smoking, if they are COVID positive, your greatest chance of getting it is through the aerosol rather than through the sharing of the cigarette butt. Even though the cigarette butt might contribute, what we know is that this is really spread through aerosolization.
Right. You mentioned the figures. Let's take a step back to something else you've also just mentioned, which is the idea that, smokers are not necessarily a big part of the populations that were looked into, if I understood you correctly. In the study that we've just looked at with Dr. Konstantinos, they did a study of about 6,000 COVID-19 hospital admissions, right, which showed that while smokers make up 26% of the entire Chinese population, only about 6.5% of those COVID-19 admissions were in fact smokers. It certainly does suggest at the face of it that there is a negative correlation, right? In other words, the more smokers they are, the fewer COVID-19 hospitalizations one would see. What would be your initial response to those type of very empirical figures that we're seeing from this study at least?
My initial response would be it needs to be further investigated. Part of the challenges is that when you get into a hospital situation, sometimes people don't disclose that they are smokers. Sometimes people are afraid of discrimination. So they might give you a false report that I'm not a smoker. So we need to be able to verify that by getting corroborating evidence. Smokers don't live alone. Let's corroborate it from others as to whether people smoke or don't smoke, because people can underreport for fear of not being treated properly because they are smokers. People could blame them for smoking. So we need to be cautious, but we also need to understand that what is coming out, there's nothing over. If we had the opposite, for example, that you have 26% of smokers in the Chinese population, but 50% of the people coming in with COVID are smokers, we would be alarmed. When we see the reverse, it shows that we don't have to be unduly alarmed in relation to COVID. But it would not be time to change policies. We still need to advocate because we know of the negative impacts of combustible cigarettes on health. We still need to advocate to people to quit if they can. But more importantly, we know that when people try to quit, they have challenges because of their addiction to nicotine. We have what we call nicotine replacement therapy, which is well established in medicine, where people are aided to get nicotine alternatives that are medically approved. We should remember that the smoker is a person. And if we are going to come up with restrictions, we still need to show some humanity and concern about smokers. And it might have been helpful and showed some empathy for smokers if we were able to give them nicotine replacement therapies as we avail them to them when they try and quit smoking.
And perhaps the opportunity cannot be more, overt than the situation we find ourselves in now. Thank you very much for your time and your insights. I certainly appreciate it. That's Dr. Kgosi Letlape, who's co-founder of the Africa Harm Reduction Alliance, a contentious issue that I imagine will continue growing legs over the next little while as we make sense of the government's decision, at least in response to smoking and tobacco products.